Now we're talking about a great prone technique to work on the upper back here with a flexible neck, roots into the upper back again. So we have our seated molding technique. We have the traditional Gonstead seated cervical chair for that area. We also have, as you see, the cross bilateral where we're more actually on the transverse. But here is a very, very powerful move because you have so much leverage. Now notice the angle here of the upper back. Anytime you're back here pushing on this, see, I'm going this way and this is angling away from me. But if I'm at the head of the table and I put my hand here, notice how my line of drive is perpendicular to the spine. So again, exactly the same. If we find C7 here, we take the very, very soft edge of the piezoform. I mean, not down here, but this much of the pad as you can get, okay? Right? Very, very soft. The key is soft contacts. That's the key. Too many chiropractors are jabbing people and getting things on tender spinuses. The patient won't say anything. They just won't want to come back. So watch, I'll show with the left hand here is I'm going to be just like this. And she will tell you, I have that whole edge of the spine right there up in that soft pad of the hypothenar, just like that. Okay? There it is. Now look at the angle of my forearm. Again, I'm going to go this way, and with the head, my hand is perfectly parallel. Notice now, I'm not going to take and turn her head like this. I'm going to almost bring it perfectly sideways, maybe just a little bit of turning, okay? Just as it turns naturally on the headpiece. You see that? So it's very comfortable for her. So I will just do the move and I'll come back and say a little bit more. They're just going to be here like this, and I'm going to watch how both hands hit at the same time, and my fingertip is actually going to hit her trap like this. Okay? And then we're going to go this way and down. Okay? And this has a little bit of a load up and a body drop, but it's comfortable. Other side, on the side coming in, down. Okay? All right, now she's already got some good adjustments today, but normally, and she will attest that will be pretty crunchy. Okay? And it's comfortable. Now remember, the more we can do prone, the better off we are. I'm almost always going to have the patient start prone, and just as a matter of my own personal preference, is I'm going to be going into this thoracic stuff first, okay? Like if I'm really going to adjust her for real and she lay down, I'm going to be right here on T4 probably first. Then I will come down to like T12 here. Then I will go up to here, okay? And that may be all I would do that day, possibly even just a littlest bit here, and I'll do some lumbar stuff, okay? But my goal is to be as efficient as we can be, so I want to do as much prone as I can, and then really I will go up and be very strict in the cervical chair if I need to, if I'm not happy with what happens here. And of course, I have no problem going to the bench for any lumbar side posture if that's something that we really have to do. But even though I might be doing a fair amount prone, and I could go to the bench, and I could go to the chair, I can do all of that and be well under 90 seconds, no problem, as you'll see in other videos, okay? So once again, just watch this, and again, you have to be very smooth and not fingertippy and not jabby. Chiropractors are like, they're all jabby all the time. I cannot figure it out. It looks like I'm literally falling asleep. Just watch how lazy this looks. All right? And it moves because when you're not grippy and jabby and all that, they'll relax. As soon as I touch, she knows she can relax. And that allows me to be smoother with the adjusting. But if you're grippy-handed and all of that stuff, it causes tension, and then people have to be jabby for anything to really move. All right? So once again, fingertip on the trap, very calm, no suction cup on the ear, okay? Very, very soft coming across, okay? And then over, boom, and you're going in this way. So you've got this scissoring, okay? Like so, okay? All right, it's a great move along with the one that we do seated in the chair. I think it's got to be part of your arsenal. People will love it, it's comfortable, and it's fast.